Hello, my name is Kaylee Schottmeyer, and I'm a nurse practitioner student at Athabasca University. So today in the clinic, I have seen Miss JM for the first time. I have not seen her before. She currently goes to school in Ontario, and she's just visiting home, and she's presented today with a complaint of dyspnea on exertion for the last 8 days. So JM, she said that she first noticed the shortness of breath while she was playing volleyball and stated that it made her legs feel weak and jelly-like. She had no pain that was noted anywhere in her body, but the episode was accompanied by presyncope. She states that it felt like she could not get enough oxygen in while doing the activity. The episode did resolve within about 5 to 10 minutes of her sitting down and resting. In the last 3 days, the episodes are now becoming more frequent and they're starting to interfere with her daily activities, which includes walking back from the grocery store with bags and walking up 2 or more flights of stairs. She has had approximately 2 to 3 episodes per day for the last 3 days. Today, she hasn't had any episodes, but she's been taking it very easy and hasn't done any physical activity today. She has tried using her Ventolin inhaler multiple times in the past week to no effect. Normally, she only uses her inhaler 4 to 5 times a year and only with intense physical activity and never during daily life. And her last asthma exacerbation was 8 years ago when she was a child. So she comes into the clinic today. She denies any cough, hemoptysis, or palpitations. She has no reported heart problems now or in the past. She has had no nocturnal dyspnea or orthopnea. She has had no syncope episodes recently or in the past. She denies any chest, arm, neck, or back pain at rest or during activity or with her dyspnea episodes. And she has not noticed any pain, erythema, or edema in her arms or legs in the past month. She denies any new rashes or skin changes, and she has had no weight loss or night sweats. Recently, 2 weeks ago, she flew home for spring break, which is a roughly 5-hour flight, and she will be flying back to school in 1 week. No other recent travel history. So for her past medical history, she did have a depressive episode in high school, which was resolved with medication and counseling, and she was diagnosed with asthma at the age of 10, and that's when she was prescribed her rescue inhaler. For family history, her maternal grandmother died of a stroke at 69 years old, and she has no family history of any clotting disorders. So she currently goes to university in Ontario. She lives in residence and has a good support network. She plays volleyball usually 3 to 5 times per week, and she works out regularly at the gym as well. For medications, she takes Seasonal, an oral contraceptive pill, for the last 2 years, and she hasn't had any side effects with that. She has a Ventolin inhaler, PRN, for asthma, but she only uses it during intense activity. She does take a daily multivitamin, and she also uses melatonin, 5 milligrams, usually 4 to 5 times per week during school to help her with sleep. For allergies, she has no medication allergies, but she does have seasonal allergies in which she takes Reactin, 10 milligrams for usually during the spring and summer months. So for her physical examination, her heart rate is 104, her blood pressure is 115/75, respiratory rate is 24, temperature is 36.7, and her SpO2 is currently 96% on room air. So today in the clinic, she appears well, she's alert and attentive, and in no apparent respiratory distress. She has no circumoral or nail bed cyanosis and no work of breathing or diaphoresis. She has no palpable chest masses, and tactile fremitus is felt throughout. Diaphragmatic excursion is 3 centimeters. Her breath sounds are equal and clear throughout, with no audible wheeze or stridor, and her trachea is midline. For cardiovascular, she has normal S1, S2 heart sounds with no murmur and no palpable heaves or lifts, but she is tachycardic. Her cap refill is less than 3 seconds centrally and peripherally, and she has no edema or erythema in her upper or lower extremities, and no epitrochlear nodes are palpated. Her upper and lower limb pulses are +2 bilaterally, and her skin temperature is warm throughout. So for this patient, my overall impression is that I would like to discuss a plan going forward for this 23-year-old female who presents today with the concerning new onset shortness of breath and presyncope on exertion. She is on an estrogen oral contraceptive pill and has had a recent flight history with a positive family history of stroke. Her vital signs are positive for tachycardia and tachypnea. I would like to investigate a possible asthma exacerbation, and I would like to rule out PE, DVT, or new onset arrhythmia. Thank you.